That you have a chance today to talk about AI and something more than just AI, but its use in medical field. My name is Justyna Umantuk and I'm a pharmacist by education. That's why I'm very close to this topic. And on the daily basis, I work with medical startups and I organize a conference, MedMeetStech, which brings together all actors on this medical market. And today we would like to answer the very interesting question: will AI help us to replace medical professionals? This is very important topic, both for technical representative as well as medical sectors. And to have a broad picture on the market and on this topic, I invited on the stage our 4 experts who will give a comprehensive view. I hope it will be a comprehensive view from different points of view. So to start with introduction, I would like to introduce you Filiberto Amati, which describes himself as a person who has a very deep focus on human side of implementing technologies. I really like this line. And he has a great experience with as a leader and with the changing companies and helping them. And he's working both in Europe, in Asia, and in America. So he has very great experience in different cultures with different backgrounds. Our another speaker, yes, applause. Another guest is Maciej Malenda, and he represents probably the company that you all know, Medicover, and you might use the services already by yourself or maybe some of your family. And since 2017, he's responsible for the department Medicover that focuses on innovations. And today he will tell us more about this part of the market. Another speaker, Piotr Orzechowski, he is representative of Informatica. Actually, he is a CEO of this company, and they try to provide on the market for the medical insurance companies as well as health providers the technical part of it, which is the algorithm and the AI. And their aim is to make healthcare more accessible for people and to minimize the risk of misdiagnosis, which is also a very big factor in the medical field right now. And our last speaker, last but not least, is a representative of the startup market and the startup itself, Wojciech Radomski from Stetomi. For those of you who might not know him yet, he is producing the small stethoscope which can help you diagnose your child at home, but I guess he will tell you slightly more later on. And to start with this very important topic of this debate, Maciej, I have a question for you. Do you think that AI will replace medical professionals, and how it will improve or impact your work today?
Hi, thank you for inviting me here. So I think the answer for the question is yes and no, because it's more complicated than just the simple 0 or 1. Because I think it will not replace the doctors for everything. So there will be always need for a doctor, but we see now, and I think we'll be seeing more in the future, that there will be parts of medical advice or evidence-based medicine with support of an AI that will be able to replace a doctor or a part of the doctor's work. So I'm always comparing it to the Excel spreadsheet in the times of 80s and 90s, where we were saying that the accountants there were calculating everything with the calculators, and then there was an Excel spreadsheet that helped them but not replaced them, because they still need to do some more advanced stuff. The same will be with the AI with the doctors. So they will be replaced the more repetitive jobs, but there will still be needed the last word from the physician.
And how do you think it will influence the medical centers market?
I think it will go more into the self-treatment and the solutions similar to the Informatica. So empowerment of the patients and the more awareness of the patients. So when they will be needed, the help will be needed, it will be more focused and more precise. and more things will be moved to the self-treatment and self-triage, self-treatment, and self-care in general.
I'm glad that you brought up the patient part, because we all very often talk about the advancements in medicine without paying a lot of attention to patient. Filiberto, can you tell us more, as you describe yourself in the sentence of putting a lot of interest in the human part, what will it mean for patient that AI will be more and more involved in the medical process we have already?
That's not an easy question, to the extent
no,
that I agree with him. There is a lot of grey. There is a lot of white, talking about the white, talking about the black, but there is a lot of grey areas. So I would say that first of all, AI, it's a very, in healthcare, it's a very complex and wide array of different technologies. Completely different technologies. They might use the same algorithms, but it's the same different technologies, which serve different purposes. On the opposite end, you have a wide array of consumers and patients, which have different hurt points. They have different type of, I would say, behaviors and expectations and rituals. So, as a father of three, I am all in for being able to assess, for example, certain things at home before I even decide to go to the doctor. I would be very happy when I am at the doctor, you know, as a client. Sometimes you have 15 minutes with a doctor you never met. And it would be great if the questions I get from the doctor were actually guided by someone who has seen my medical history. Personally, I wouldn't want the doctor to be replaced by a robot. But on the other hand, I wouldn't invest my money through a robot either. And robot advising and robot investing, it's a huge stream of business in the fintech industry. So there is a market for that as well. So I think it's all a matter of what are your, as a consumer, as a patient, what are your expectations, and as a doctor, is what is the type of efficiency of support and hurt point that you're looking for. And there are different technologies which can help with that. So it's a bit in between.
Oh yeah, definitely. I guess that AI is so broad definition that you cannot actually just focus on just one part. Especially, it's interesting what you mentioned, that maybe as a patient, as someone who is taking like care of themselves, we are more willing to implement the solution just straight away. And with the medical doctors, is slightly different. And I would like to ask about you one question, because your solution is using AI. Do you think it will be possible to implement on the market similar device without using this technology? Will it be possible to replace it with someone else or something else? What do you think?
So first of all, I think that we always have to remember what technology in current days allows us to achieve. So I personally think that AI in next few years is going to definitely help doctors to do their jobs better, because there are a lot of different fields where AI can be better than the human mind. Let's take, for example, a study made by AOK. They found out that in Germany, every year, 20,000 patients died because of misdiagnosis. And they found out the reason that, on average, a doctor during his career can study approximately up to 1,000 different diseases from 30,000 different diseases that are on the market. So it shows us that there is a huge opportunity for improvement. But at the same time, in my opinion, current AI technologies, current IT technologies are not advanced enough to replace the doctor. So we will always need them. But at the same time, there are a lot of different small pieces of medical examination where AI can be much better. And taking our example, we have an electronic stethoscope which analyzes the sounds from the heart and lungs. So we personally believe that this small piece of medicine, identifying sounds in the lungs, can be done by AI much better than the doctor. So it's an improvement for the doctor. Thanks to this data, the doctor can make a better diagnosis. If we move back a few years ago, there were no blood level sugar tests. So also the doctors were lack of this information, so they were making not a very good diagnosis. Today they have this tool and they cannot imagine how to work without this tool. So this is a great example how advanced the technology can improve the treatment process.
And you work closely with many doctors, introducing your product and trying to test it. I watch you closely. So can you tell me, what about the trust? What is the trust level of doctors you are working with? Does it change over the time? Because you can probably have a few years perspective already.
Yes, it definitely changes. The best example is, I think, the example of the companies like Medicover, because we are in this field for 3 years. And 3 years ago, companies like those private healthcare providers were not interested in talking with us at all, because the law was not allowing them to do such services. The law has changed, and all those big companies are starting to implement telemedicine solutions. And the same thing happens with the doctors. Before we started, our idea was to make a diagnosis. So we were going to the doctor saying that we will develop a solution that will tell you if you have a pneumonia or not. And they were kicking us out of their cabinets because they were afraid that we will change them into a technology. So we changed our approach and we said, okay, we are not going to diagnose. We are going to be a measuring device that will give you an additional information, and based on this additional information you can become a better doctor. So this changed everything, because they completely understand that their skills in some fields are not so good. One of the Philips executives told us that listening to human lungs is like an art. And me personally, I do not want to be treated by an artist. I rather want to be treated by a scientist. So what we are doing, we are changing this small piece of art into a science, and those doctors understand it. They understand it that human sense of hearing is very subjective, and if we could change it in something that is objective, that has some rules, it's much better for them. So there is a trust in such solutions.
Nicely said, thank you. And when we think about the numbers and actually about transferring from artists to scientists and diagnose, I'm wondering what are the actual numbers that can show us the meaning and the size of this problem of misdiagnosis right now. And Piotr, I read that your solution is used worldwide by more than 3 million users. You probably are the best person to tell us more about the overall perspective. How do you see it right now in the terms of misinterpreting and misdiagnosis?
Of course, happy to do that. So first of all, what we provide is a tool for checking your symptoms. So instead of Googling your symptoms, you can use one of our apps with AI under the hood, of course. So we take slightly different approach to Stetomi and Wojtek. So we go rather broadly and focus on main family medicine problems. So if you have cough, if you have abdominal pain, if you have some headaches, you can try and use our app. And of course, our goal is not to provide you with a diagnosis, but rather recommend where to treat your symptoms in the best possible way. This can be, of course, self-care, this can be teleconsultation, you don't have to visit a medical doctor for most of the problems. And yes, we had more than 3 million users so far who completed the interview with our chatbot.
I'm one of them.
Oh, perfect, thank you. So our business approach is that we white label and license this tool to medical companies, insurance companies, and so on. And the results depend on the particular partner. So for example, in one of the largest insurance companies in Europe, we have seen that 26% of patient cases can be treated at home.
Yeah, that's a huge number. But what about the responsibility? Because that's one of the main topics that rises when we talk about the AI. Will patient take this information as a final diagnosis and, for example, not go to doctor? Do you see it as a problem, and do you have any solutions or any ideas how you can prevent that?
So we don't see it as a problem, but we see it as a challenge for sure. So I think it's all about the proper communication. So first of all, we don't say that this is to replace a physician, and we don't provide diagnosis. So there are legal disclaimers, and we want to make sure that people understand the purpose. And in the history of all patient sessions, we never had a situation when someone misunderstood the purpose of the tool. But also taking care of a proper regulation is very important. So we're Class 1 medical device, and now we're looking forward to Class 2A, Class 2B, so this also has to evolve.
If I can add something to that, we are working a lot with different studies that are made all around the world. And there is one very popular study made in the United States showing that average accuracy of family doctors in identifying sounds that are characteristic for pneumonia is only 25%. So this is a big liability. So if we will manage to achieve algorithm that has any accuracy better than 25%, there is still a liability issue, and we have informed the patients with proper disclaimers, but anything better that we can do with AI than the level that we have at the moment is better for the patient. So even having 30% of accuracy will still be better.
I think I have to disagree on that. Sorry, but based on my experience with the physicians, they expect to be 90 to 95% accuracy. It's the case like with the automatic cars or the self-driving cars. Even though they will be 3, 4, 5 times safer than the driver, we have some kind of tendency to say like, oh, we are humans, we can make mistakes, but the robotic systems or the AI systems cannot make them. So I'm disagreeing just because I'm using the same arguments inside my company, saying, oh, this company that I'm bringing to you have like 85% of accuracy and the normal doctor have a 25%, and they're saying, yeah, but nobody cares about the physician, and what will happen if the system will be wrong? So I think it's more tricky than that.
Yeah.
But that was just one example, but if we will connect AI with a doctor, and if we will split into 2 parts, that we have one part of examination which is listening to the lungs, and we know that doctors have 25% of accuracy, our algorithm currently achieve around 80–85%. And we add to that the diagnosis procedure, we can receive much better results than just, relying on the decision of the own doctor without AI.
Yeah, I agree with that totally.
And when it comes to health, somehow we are taking more decisions emotionally, and it's easier for us to believe that, okay, doctor might make a mistake, but we don't allow the machine to do that. Filiberto, what's your opinion about other challenges that we might face implementing more and more AI in the medtech sector?
I think what we are discussing here, it's the key. Processes, it's easy. It's the human side which is complicated. When you talk about the AI, there is also a fear factor, which adds to the pot. And I think that they're both right, to the extent that you need to, first of all, to be successful, my recommendation is always start small. If you try to make a revolution out of it, the organization, the people inside the organization, they will look for the guillotine, as it happened in other revolutions. So start small, low-hanging fruits, and try to decline the benefits in a way which is relevant to the people you're dealing with. Okay, in the US, I would say that liability ticks a box very high, because doctors know what's the cost of their insurance, what's the cost of, and they all, especially when they have 20 years of experience, they all have experienced some sort of court case. or had to settle, so the lawyers and so on and so forth. But you know, for larger organizations, I think it's more about the experience, the convenience. That's how telemedicine got sold and became so successful to a certain extent, because there were benefits for the operators. The doctors understood that they could be more efficient, and from a consumer point of view, convenience, you know, the fact that you don't have to go to, but it's coming to you, it's actually a big thing. So at the end of the day, I think that start small, low-hanging fruit, get people to create an habit, get used to certain technological aspects, remind them it's AI, and then from there you take it and you make it slightly bigger. Which is basically what you're saying, but putting from a consumer perspective or a human perspective.
What about the cultural challenges? Because working on different markets, you probably see differences in implementing those technologies in well-developed countries as well as deep down in countries that they're already starting with the advancing medicine. How does it look like?
Well, if you travel, the culture is always the difficult part, to the extent that if you have had an experience with a doctor in Germany, a doctor in Austria, a doctor in Poland, or a doctor in Italy, they look to you people from completely different parts of the world that are speaking different languages and they want to do different things. Okay? So that's the challenge. That's why you need to have specific, relevant, local insights. What you sell to a German, it's not what you're going to sell to an Italian. Even if it's the same technology, even if it's the same benefits, how you sell it, you know, you mentioned earlier, we take decision emotionally. Yes. By the way, it's not always the numbers, you need the numbers. The numbers give credibility to the solution. But we actually do take decisions, most of our decisions are emotional, even in investments. So the cultural part is more about really localized insights.
So how does it look like from your perspective? Because your solution is not only used in our country, right?
Yes, I have to fully agree here. So healthcare system works completely differently in Germany, Poland, Portugal, US. So it's a different value proposition, different target groups, different people that we talk to. So, but in terms of technology, it's very much the same. So we support 12 language versions. So we talk about symptoms, the medical part is the same, but business expectations are different.
Yeah, probably that's true. And as a final question, since we have only a few minutes left, can you give us your thoughts about what will happen in 5 years in the medical sector thanks to AI and similar technologies? That's the question to all of you.
So, as I said before, I believe that we will find a small niches in different categories, and AI will help doctors in those very tiny pieces of medicine, and thanks to those solutions, they will be able to make much better diagnosis.
Thank you.
Yeah, to add on that, I agree totally that from the physician point of view or the doctor's point of view, it will be the small additions. I think also there will be a small revolution from the patient perspective. So all the things that are happening even now with the solutions like the last winner of the Wolf Summit, so the CardioCube, the Amazon Echo or the Google Home or any other solutions and assistants and voice assistants will be revolutionizing not only healthcare, but healthcare will be brought along with them. So I think there will be changes in the patient communication with healthcare.
I think we will see the evolution of the legal frameworks that will allow to implement such solutions faster and easier. And also I think that more traditional health organizations will look into collaboration with startups or like technological companies in general. That's what I hope for, at least.
Yeah, we all hope for that.
Just to add some spice, because I agree with what they said, I think the smartification of devices will actually bring more devices to offer service, which they will be based on AI going to actually open APIs. So collecting your data, but matching it with more data coming from wearables, coming from other type of sources, which brings me to the other point. I think that Because of that, there is going to be a lot of convergence between wearables, healthcare, fitness, well-being, connected cars, retail experiences. They all will come closer in the way we generate, share, and use the data. As long as the legal framework allows that, by the way.
Well, yeah, that's always the biggest obstacle. And as a medical professional, as a pharmacist, I'm aware that, okay, that AI might not replace me, but it will help me. And I guess it's also important to remember that we already use it in so many aspects. And when you think about this AI in medical field, sometimes we make it sound so scary that medical world is not very willing to open their places for implementation of new solutions. But I hope it will be changing gradually, as you said, and we will see it in a very small, every small piece of the smart devices that we are around ourselves very often right now, and we'll get the more data that will help us cure people and help people better. Okay, so thank you very much, and I hope that if you will have any question, we can lead this discussion later on in the networking space. Thank you very much.